Right.
15 minutes?
Yes, absolutely. Great timing. So I would like to thank Mr. Hisham for the very important presentation about food safety. And at this time, we are actually, it's 12:45, and this session should end by 12:45. So we have 1 minute. However, I think if okay, we could add another 10 minutes and take about a few questions for the entire panel that everybody is sitting here. And if you would please limit your questions, and if you could direct the question to a specific speaker or two speakers or whoever that you would like to answer your question. However, we'll give everybody on the panel an opportunity to answer the question. So if we may get started. Okay, sir.
Good morning. My name is Wilson. I'm from Geneva. My question will go to Mrs. Farida Fortune. As a professional involved in the medical sector and in public governance, how would you assess the gap between the work done by WHO and the needs in the real world in the field? Thank you.
Thank you. When in 2015 at the UN, they looked very carefully at the Millennium Goals. And as you know, most of them weren't completed. And so that was a huge disappointment. And then they went on to the Sustainable Goals. Breaking it up into the smaller sections, I think it's much better. I think on the larger scale, what has happened is that money that used to go to countries are now being put into big research projects. And one could argue rightly so. I think what the UN has to do is make sure that when those projects are funded, there is built into the projects governance and ethics. And I think that should be much tighter than it is at the moment. I was talking about localism, but I'm actually been involved with lots of projects, and at the moment, one with a 12-country looking at a disease outcome for diagnosis. And it was only Makerere that said, you know what, we don't think that this ethics is tight enough, because all the information is going abroad and we locally can't even see the data. My job is working in these projects. I work on the delivery. Okay, so we write the software. We always go into the field and make sure every single country can run the software. So I've just come now from a work camp to do that. And I think that's quite important. You have to get feedback from the people on the ground. And when you go, I think the UN also has to say, not just write that there should be sustainability, to be quite prescriptive what people leave behind. Because going all over Africa, you know, these big projects, HIV, TB, other infectious diseases, you can't treat them for 2 years or for 3 years. And they're measuring such short outcomes. You should say, well, go back in 10 years' time, what is your long-term effect of that project you did? Because it's a huge amount of money that the UN uses. And I know that a lot of money, gets used for other things by the UN. So the bit that's left behind, I think really, really important, is that structure. I know I keep on saying ethics and governance that is built in. Local people understand ethics, they understand the governance, not only us who are the people holding the grants. Thanks.
Okay. Another question? Yes. Sir, please.
Saif Bashir again. It's a question and a comment going to Professor Farida Fortune. I had the honor of knowing Professor Fortune a few years back when she was the Dean of the Dental Institute of Queen Mary, and I'm very pleased to see her today again. all the papers, including Professor Bani's and Mr. Hassan's, are all, 3 papers are actually extremely excellent and very informative. A few pictures that Professor Fortune has shown actually took me back 20 years ago when I was involved in a research in the area, Niala, Buram al-Dain in South Darfur in Sudan. And I visited 47 villages, and the project has to do with water supply in these areas. I witnessed a situation where people would drink from the same well with their animals, like donkeys. And I'm not very optimistic that this picture has changed 20 years now. What I'm driving at, the success of all these goals, the 17 goals, the quality education, quality health, no poverty, hangs entirely on the philosophy and the aims, the goals of the political system. If they really want a prosperous life for their people, rather than focusing or being self-centered elites, the question is, how can the UN, with different organizations and operatives, make sure that these governments or the people controlling these regimes implement these programs or these policies or these donations or these grants successfully to the best interest of the people, rather than, because I don't want to go into the area where there are corrupt people who channel these donations and grants to their own interests.
Thank you. So if you would give the opportunity to the panel, it seems like this is a very general question, and I would like to maybe start with Professor Bani.
It's concerning the gaps, especially for the working with some government, like in Sudan. I work with NGOs, with the government, and I found that always there is a pressure from the government on NGOs not to give them freedom in implementing programs, and even sometimes there is a lot of issues concerning the funding. I'll give you an example on the iodine deficiency in Sudan and salt iodization. At that time, the level of salt utilization of salt is very low, one of the lowest in the world. And the solution was to develop a national iodization program. We tried through micronutrient initiative for years, lobbying in Sudan from 2004 until 2012 with the micronutrient initiative to conduct that national salt iodization program using because the main plants are in the Red Sea. This was not possible because there was a pressure from the government to get all this support to be financial support. But MI refused. I give only in-kind support. And tried lobby. Even the Council of Ministers has one meeting in Port Sudan near the plants to lobby for this. Still, the governor refused. But after many years after that, after I left the country, this salt plant utilization now was given to one of the senior key government lobbyists, Ali Osman, who is the vice president at that time. Now he is dealing with this plant, which millions was. There is a big issue of this corruption.
Professor Farida?
Yes, I think the problem with governments is they're there for a short time. It's politically driven. They have to deliver something, right? And they have what I called a top-heavy administrative structure. So before the aid or money goes down, it's used in administration. So one of the things that we have done is, because we work through remote delivery is that you can get money to the people who are going to deliver. So I've come from a work camp on a big project. All the equipment that is needed for the project has been decided by the people who are going to use it, bought, brought to them, and then tested for efficacy and ability to use. So you know you're not going to be wasting money at that level. You work through the local higher education, so the universities. The universities sign the contract. And as you know, we've got this big global structure of universities. So the universities are overall very accountable. So the money goes through the university. We supply a lot. We collect all the data shared at the camps. People take data away as well. And we know that the equipment we've given them is going to be used later on. So that's the only way, I think. And then when you have your results and you keep on monitoring them, the government actually sees value in it, right? Because there's been a positive outcome and the reflected glory are for the government. And you haven't wasted your money on administration. And I think that's the only way to do it, really.
I think I have something to add about this, especially for the water problem, because I had an experience with this. My project, I had a project about using traditional or utilizing traditional water purification methods in Sudan. I used a plant called Moringa oleifera to purify water. I basically crushed moringa seeds. It's a published article about this usage. And I reduced the microbial load in drinking water to the lowest. I introduced this project or this research to the Ministry of Health in Sudan. And they were very pleased with it. They called me to the ministry office. I said, you know, I waived all my rights as long as poor people are going to benefit from this project, and it's still sitting there somewhere. So I think the solution to this is assign some local NGOs, like volunteers, show them the method. I even invented a device or an apparatus that's like basically a puck, just like a hockey puck, if you're familiar with it. And you basically drop it in the water and you wait 6 hours and it's boom, it's almost clear. It's very simple. I can basically assign it to a local group of people who can teach locals how to purify water. And I think this is a very suitable approach, giving in consideration how the Sudanese communities work. Okay. Thank you.
So thank you so much. If I just may add just a very quick comment on this, based on my experience in working in Africa, in about 27 African countries, is we always go through a cycle whereby we're so worried about funding that goes to goes to government, and then it gets wasted for somehow, or it sits and nobody does anything about it. And at the same time, we kind of diverted also a lot of resources towards NGOs on the ground. And at the time when they leave, as many of the presenters, there's nothing left. And so we're kind of between, a rock and a hard place, whereby you sometimes want to give it to the government and it gets wasted because there's a lot of corruption, and you give it to an NGO, and then at the end, there is nothing to show for after 5 years or 6 years. So this particular predicament that we're in, it needs to be definitely worked at by more education. The new generation is definitely different than how we were perceiving the world. They have a better view of the world, and hopefully we could see right now as a very striking example in Sudan, the young generation, what they've done in the revolution, and how they really have transformed what we think about of the only way you can change government in Sudan through weapons. You can actually do it through peaceful sittings, and they're still insisting on it. So somehow there is a big shift and paradigm shift on how people think. And I think governments are going to follow, because governments are made of the people and for the people. So somehow there's going to be a lot of change. So if we might give one last question before we conclude this session. Okay, so we have, yesterday there was a rule that they have the highest arm up, and that's the one we're going to choose, and that's the one there. So sorry about that, but please go ahead.
Hi, I'm Lorraine from the University of East London. I can share my question. It's just a quick thing about merengue seeds. With regards to not having the device, do you have workshops or any events that I can actually take part in, so that I can actually go ahead to small developing countries like the Caribbean and show them how they can use the merengue seed, because there's quite a lot of merengue seeds in the Caribbean.
Okay, so you can go ahead and ask your question.
Yeah. Oh, sorry.
So actually, the problem we do have in India, we do have the government is actively participating in providing food at subsidized rates for the poor. But the biggest problem faced is even though the food is provided, there's lack of quality, and the safety of the food that's provided is a questionable state. So I just wanted to know what are the possible outcomes to maintain quality and safety of food that is provided already, besides without any sort of local politics playing and without anything participating like that. Thank you.
So you're the last one. You still have that question? You still want to ask it? Quick question. Very quick. Go ahead.
Okay, we've spoke about blockchain. There's also a product called hollow chain, which uses less energy. Would that be a way for the panel to work together so we can actually put money in and see it in a blockchain, open-sourced way?
And that does happen already.
Okay.
Yeah. So I think using something like that and making it more sort of universal is actually a very good idea. Excellent idea, actually.
Okay. So, Hisham, since you got the first question.
Okay. So in regards to the use of Moringa oleifera in water purification, like I said, I did publish an article in that regard. I can give you the link, or you can just Google my name and put Moringa oleifera or water purification, and you will find it. Like I said, I waive my rights to this invention or this research, as long as the use for this device will be for poor people, for non-profit. I have no problem with that. I can communicate with you and give you some details about it. In regards to the outcome of applying or adapting food quality, and the method of achieving that is basically to raise the awareness amongst local consumers, amongst even family members, about their duties and about their rights. And we have so many channels to achieve that. We can start with our households. We can also reach out to schools, to use local churches and mosques, and it's achievable. We just have to focus on those groups and work our way up, and it is going to happen. And I'm actually I'm a very good follower to the food safety and quality system in India, and it's very impressive. Thank you.
Okay, I would like to thank our panel, and would like to thank all of you for taking the time. And I know we're a little bit above time, so that's cut a little bit into your lunchtime. And we hand it over to Professor Alam, and would like to give just one more round of applause for our panel today. And would like to thank all of you.
So please remember, if we all help and do a little bit, it will make a big difference.